Tēnā tātou katoa, good evening. When Labor came into power, the country had 608 beds for acute mental health patients. 5 years and almost $2 billion in health funding later, you would expect that number to have increased to meet demand.
But there are still only 608 beds, and Newshub can reveal earlier this year the Health Minister ordered a deep dive into why mental health infrastructure isn't being delivered. Political editor Jenna Lynch has this exclusive report.
This was the TikTok video that made Health Minister Andrew Little sit up and listen.
A mattress on the floor.
A video Kiana filmed inside a mental health unit in June last year. And now,
I'm disappointed that nothing's been changed. Yeah.
Our mental health facilities are not up to scratch. Back in 2019, the government announced a $1.9 billion program to fix it up. But Newshub can reveal there are exactly the same number of acute mental health beds now as there were when Labor took office.
I'm not surprised.
In 2017, there were 608 beds. It's fluctuated since then, reaching a peak of 619 in 2021. But now, we're back where we started, 608 beds.
Well, it's quite astonishing the government has gone and spent $1.9 billion of taxpayers' money on mental health, and we don't have a single extra mental health bed available. You've got to ask the questions, where has the money gone?
It's taking way longer than it should do, but there is progress now evident.
Last year, after Newshub revealed the lack of progress in the program, the government ordered a review with damning results.
They did the review, and what's come of it? No one's seeing it on our end.
Now, new documents reveal it's still so bad, ministers have directed their implementation unit to team up with the Infrastructure Commission and complete a deep dive into each of the 16 mental health infrastructure program projects and create a delivery plan that ensures projects gain momentum and get moving.
The funding was available from 2019, the commitment was available from that time. It still beggars belief for me that it has taken this long to get those things going.
It beggars belief for mental health patients too.
Well, our political editor Jenna Lynch joins us now from Parliament. Kia ora, Jenna. What is going on?
The ministers clearly want to know too. Andrew Little told me today a lot of these problems will be solved by the centralisation of all of those DHBs into Health NZ, a uniforming of the infrastructure process, and he also said that there is good progress being made. About 4 or 5 of the budgets of the projects that were funded out of budget 2019 will be finished by the end of next year. But this information gathering stage is now over with the second review. They should know exactly what took so long, why it took so long, and the job now is to make sure that nothing takes that long again, especially when it comes to something as serious as the mental health crisis.
And Jenna, do you have an update for us on the Ukrainian president addressing our parliament?
Yes, I've just been told that MPs have agreed to host President Zelensky for an address to our parliament via video link. A date has not yet been set for that, but the Prime Minister is hoping that that will happen before Parliament breaks for the summer.
Ngā mihi, Jenna. Thanks so much.